Thank you for joining the Heartline.info report on AEDs. Hey, everybody. I'm here again with Enrique Christopherson of Cardiac Science. Enrique, of course, is the regional sales manager for the territory of San Diego and Imperial counties in California. I wanted to talk about differences between the Powerheart units. Could you tell us what the difference is between the Powerheart Plus and the Powerheart Pro?
Oh, absolutely, Steve. Our flagship, the Powerheart AED G3, is designed for the lay users. This device will talk the rescuers into doing the basic rescue scenario regarding when somebody's in cardiac arrest. Basically, it will prompt them with a text display where it will mirror the voice prompts as well as the verbiage coming from the machine, telling the rescuer what to do step by step. The Plus version is just added voice prompts, which will guide the rescuer throughout the CPR process. You know, with metronome, which a metronome basically is a cadence of compressions during the CPR, and it will guide the rescuer to do an average of about 100 compressions per minute. Now, the Powerheart AED G3 Pro is designed for the professionals. This device has a colored ECG display, and unlike the standard Powerheart AED, it has a manual override shock button. So the professional rescuer, the EMT or a physician, if they see a rhythm that they want to shock on the ECG display, they have the power to actually transform the AED into manual shock mode. Now, this device is not recommended for the lay user since you could shock discriminately or at your discretion. So we do have a limited vertical market on where we do push the Pro to. Again,
all right, just to explain this to folks, when you say layperson, you mean that basically anyone off the street, if they see someone have a heart attack and they have had some limited training, they can pick up an AED, in particular a Powerheart G3 AED Plus, and it's going to talk them through the procedure. They're going to put the pads on the person. It's going to deliver the shock, and it won't deliver a shock that can hurt someone, is what you're saying basically.
That's correct. That's correct. Our Plus version, our automatic device, will, again, go through the steps. The user will just simply open up the lid. It would activate the voice prompts. The voice prompts will guide the rescuer to place the pads on the victim's chest. And then the rescuer would stand back, and the device will take over. And if it detects a shockable rhythm, it will count down from 3 to 0 and deliver the shock by itself. But we added a safety feature on our automatic devices. For example, as a non-committed shock feature. That's if a rescuer is actually touching the patient, the AED will recognize that artifact, that noise, knowing that it's not coming from the victim. It will hold off on the shock once it's committed to charge, and will advise anybody who's standing by to clear away from the victim. And once they've disengaged themselves from the victim's body, then the device will go ahead and continue with the therapy.
Okay, and then the Powerheart Pro is what you're going to see with a paramedic unit when they come with a fire truck, or in the ambulance with the EMTs, or in a doctor's office, where they have the ability to override the unit and deliver a shock when they know it's best and under a doctor's control or a professional's control.
That's correct. Most EMTs and paramedics, they carry manual defibrillators, and these devices cost about like $35,000. Now, the Powerheart G3 Pro is not designed to replace the manual defibrillators, but it bridges the gap between the lay user AED and the manual defibrillators.
We've been speaking with Enrique Christopherson, the Territorial Sales Manager for San Diego and Imperial counties here in California. Thank you for joining the Heartline.info report. If you would like more information, please go to www.heartline.info and sign up now. We will send you any previous recordings as well as notifications of upcoming interviews with experts in the field of program management for CPR and AED training and management programs. This is Steve Larvick, Affordable Medical Equipment, for the Heartline.info report. Thank you very much and have a great day.